Okay, Mr. Dubois, I just wanted to go over a few teaching things with you. So I know that you are receiving morphine for the pain in your hip, and it's really important to kind of tell us, when your pain is getting severe, because it's much easier to treat your pain before it gets to the point where it's excruciating. So we want to keep administering the pain medication kind of around the clock so we can control your pain better. There are also other ways to control your pain that are non-pharmacological. I wanted to talk about guided imagery and distraction. These are important non-pharmacological ways that I like to tell my patients to reduce some of their discomfort. It doesn't totally get rid of the pain, but it does take off the edge a little bit. So guided imagery is the first thing that I wanted to go over with you. I'm going to have you close your eyes and picture yourself on the beach. Do you like the beach? Yes? Okay. So close your eyes and picture yourself on the beach free of pain. And this is going to help kind of guide your mind to somewhere else. It just kind of distracts your mind and gets you away from that severe pain level. Another thing that I really like to talk about is distraction. It's kind of along the same lines, but you think of something else that is, pain-free, it makes you happy, and it does just kind of take your mind off of the pain for a little bit. What I wanted to talk to you about was the SCDs that are on your legs. So these are little machines that kind of fill up with air and they compress your legs. I know they kind of feel a little funny and you're like, what is on my legs? But these are really, really important because it helps prevent venous stasis. So the more that you lay in bed, especially after surgery and after a hip replacement, you're going to be doing a lot of healing in bed. So these are going to prevent the blood from pooling in your legs, which prevents blood clots. One of the medications that we are giving you here in the hospital is called Lovenox. It's a low molecular grade heparin. So this is going to be another way that we prevent blood clots as well. So it's just going to thin your blood a little bit, and it's going to prevent those blood clots from actually forming. One of the things that I can't stress enough is using your incentive spirometer. I know you've seen this on the side of your table over here, and it's going to help open up those alveoli in your lungs, and it's going to help prevent atelectasis. Atelectasis is one of the more common things that patients will get after having surgery, because they are laying in bed and healing and taking that time to heal, but they are also being stagnant. So your lungs aren't kind of moving, the oxygen isn't flowing in and out as much as it usually is when you're up walking around. So it's really, really important to use that incentive spirometer. Now, what I like to tell patients is, the TV's on, every commercial, you want to do it 9 times. So you just want to take a breath before, and then you want to inhale while using the incentive spirometer. So I'm going to show you how to do it, and then I want you to show it back to me how to do it. Okay, perfect. Okay, so another thing that I wanted to talk to you about was to increase your fiber and protein in your diet. So a little diet change can help you go a long way, and it can help prevent infection, it can help increase your chance of healing, and it can also help prevent constipation. So you are taking morphine right now for your pain. One of the more common side effects of morphine is constipation. So with your hip replacement, it's really easy, we don't want that constipation to happen. We want to have the least amount of stress on your hip as possible. So in order to do that, we need to kind of increase our fiber in our diet. It's going to help soften the stool, and it's going to make bowel movements more regular. Increasing protein in your diet is really, really important as well, because protein increases healing. wound healing. So, you know, with your fresh surgical incision on your hip from your surgery, it's really, really important that we want to increase our protein in our diet to get that all healed up. We don't want to have any infections. We want that to heal as quickly as possible. Another thing that I wanted to talk to you about, it has to do with your diet, is increasing your fluid intake. It's going to help regulate your urine, and it's going to also help prevent dehydration, and it's going to also help promote wound healing. So we want to be increasing our fluid intake in our diet as well. So can you tell me the 3 major things that we need to increase in our diet to kind of help prevent infection, prevent constipation, and to help promote wound healing? Protein, fiber, and fluids. Perfect. Okay, so another thing that I wanted to talk to you about, I know that you just had surgery on your hip, but there are some precautions that I wanted to teach you about. So it's really, really important to follow these precautions strictly, because it's really easy to dislocate your hip, and we don't want that. We want it to heal, and we want it to be working better than ever, better than it was before. So we want to keep our legs abducted, and we want to keep our toes pointing upwards at all times while we're laying in bed. We don't want to be kind of moving around, and we don't want to have any chance to pop that hip out of place. Another thing that I wanted to talk to you about was